Yeah, the four main informal settlements, as you are aware, is Mukuru, Kibera, Madare, and Korokocho. Those are the highest populated informal settlement. There are many more in Nairobi. There are over 12. So we will look after all of them as we get this kind contribution. But we can't alleviate each and every person's problem, but we try as much as possible to assist. So this will be divided into four, and it will go to the four main informal settlements.
In Nairobi, COVID-19 cases are surging each and every day. What is NMS doing maybe to contain the situation in the city?
NMS is doing a lot. First is provision of free water. We are providing 22 water bowsers that go to the disadvantaged communities and informal settlements. That we started from day one. As you are aware, during my 100 days presentation, I said that we have built 93 boreholes within disadvantaged and informal settlements. And within my next 100 days, I'll be building 100 more new boreholes that will take care of the water shortages. You know, water is the most important item in helping to prevent COVID by washing hands. We are also providing soaps and sanitizers to help assist the people in informal settlements. And again, building this hospital, the 24 new hospitals in informal settlements, will also help not only in the isolation but also in treatment.
Maybe to ask with regards to this particular consignment here, which criteria are you using to distribute it to the specified areas, or is it first come, first serve?
No. Remember that the government has got proper machinery in terms of administration. So we have the RC in Nairobi, and beneath him there are DCCs, what we used to call DCs before, and DOs and chiefs. So they, especially the chiefs, they know the most vulnerable because they live within those communities. So they are the ones who will come up or draw up the list and will distribute according to their knowledge and experience.
I heard you saying that you are putting some infrastructures in the Mama Lucy Hospital and about the bed, all those things. But still, the doctor union, they are lamenting that they are overstretched. Why the government is investing on facilities and in manpower that will have contained this? I don't know what is since the government has advertised, I think this in the brain, up to now nothing has been done. I don't know how are you going to cope up with this COVID-19 which is increasing in Nairobi?
I disagree with you when you say nothing has been done, because only as NMS we have already recruited a set of doctors, nurses and other medical specialists. If you look at the paper, we are in round 2 now, recruiting doctors, nurses and other medical profession. So we know that we are overstretched, we know that we have a shortage, but according to the budget allocation, we can also not just recruit without taking care of the remuneration, because the salaries is a problem. As you saw the other day, there are some clinical staff and nurses striking because of overdue payments that were promised to them by county. So we do not want to promise them something that we cannot fulfill. We want to recruit the medical personnel that we, within our budget, we can pay. So we must be realistic. So we are recruiting them, and we'll continue recruiting. Even these 24 new facilities, you will soon see in the advert the recruitment of doctors and other medical personnel, because these are going to be newly established hospitals, and by September we would have recruited the medical staff to take care of those hospitals.
Two questions. Yes. How many families do you intend to reach with this in the 4 settlements with this donation? And then on the 24 hospitals, do we know the lands? Because you say it should be ready by September. So how much money has been allocated for that? Do we have the land ready? And what kind of hospitals are we looking at?
In terms of how many families this will be distributed, that I cannot answer because it will be worked out by the current administration that is on ground. They know how many families are affected, and of course this food cannot reach each and every family in informal settlement. But it will go a long way in helping those who get it first. There are people who are very hurting within those informal settlements. And I know there are very many organizations, NGOs and international NGOs who are already on ground helping. So this will go a long way in augmenting the already existing aid that we have. In terms of the 24 hospitals, yes, we have identified the areas. You know, informal settlements are usually very squeezed. There is no even space for people to play, children to play. So they are highly congested, but we did it through approaching the community leaders, the administration in these areas. Some of the land has been given by churches. Some of the land that we are going to build the hospitals have been donated by schools. And some areas we are going to use the areas that the current administration are sitting on, like the chief's place. It is quite difficult, but yes, we have identified several areas that we are going to build a hospital. I was very touched the other day when I reached Udhiru. A 91-year-old woman gave up her plot in order for us to build a hospital for the community. So yes, we are getting very good gestures from community who are giving up their land to ensure that these medical facilities reach the people most affected.
To the
So
budget?
how much money has been allocated for this?
The budget is actually going to be provided by Ministry of Health. Mine, I will take over after the facilities have been built by them. So I do not want to interfere another government organization in how they are going to construct it. All I know is the hospitals will be ready in September.
One last question.
Yes.
Politics.
Yeah.
Over the control of Nairobi County between the NMS and the county government led by Mike Mbuvi Sonko, do you think it is affecting your work?
First of all, I'm not a politician. I'm an administrator and a KDF personnel. So I don't get engaged in politics. One of the core values of KDF is to be apolitical, not to interfere with politics. So mine is purely service delivery. So I have no problem with the governor. He is still the governor of Nairobi. I'm only performing the duties of the four transferred functions, and mine is service delivery.
Thank you.
Just one final question.
Yes.
Still on this point, we understand there has been a disagreement, especially on matters budget between the NMS and Governor Sonko. Does that derail your service delivery to the Nairobi citizens? And the second question, solid waste management is still an issue, especially in informal settlements and even through our spot check in history. Is the NMS aware, and what measures are there to act upon that?
Yes, the budget affects anything in administration. But remember my background, I'm military. When I'm given a task, I fulfill it without thinking of what hurdles comes in my way. Second, NMS is part of national government. So if I don't have a budget of my own, I use the budget of existing ministries, which are national government, to perform my duties. So by no way am I distracted from performing my functions.
Executive Chairman of Unique Group of Companies, Chairman Giants Group of Nairobi, my fellow group members, ladies and gentlemen, good morning.
Good morning.
My name is Sania Ahad. I am the Director of Administration for Giants Group of Nairobi. I would like to thank you all for coming here and being with us today. I would like to urge all organizations to please give your hand with the government so that we can improve our lives, not only as Kenyans, but as a nation. I'd also like to encourage the youth, as I'm a youth, that we comply with the COVID-19 regulations and help our elderly also comply, because our youth is a healthy nation. Thank you.
So perhaps now we can allow the Major General to podium.
Good morning, ladies and gentlemen. My name is Major General Badi. I'm currently the Director General NMS. I'm very proud today to be here associated with a giant group of companies for this kind and noble gesture that they are donating foodstuff. This foodstuff will mainly go to the informal settlement and the less privileged community within our society. During this period of COVID, they are the most vulnerable and most hurt when it comes to employment, when it comes in terms of prevention of COVID, medical facilities. They are the most disadvantaged group in our society. So this will go a long way in not only helping but trying to alleviate their problems that they are facing currently, mostly in the informal settlement. We have started off this kind of gesture last month when unique group of companies donated mask sanitizers and other stuff enabled to contain the spread of COVID. So we are very grateful again. The giant group of companies are today donating foodstuff. You are all aware that the COVID statistics now stands over 9,000 and it is still growing. So we urge everybody to take measures according to what has been given by Ministry of Health. We are working hand in hand with Ministry of Health to ensure that this pandemic does not spread. We have already launched this morning an awareness program, also given by certain donors. We are working very hard to ensure that the less privileged in our society are taken care of in need of either education, in need of prevention. So as NMS, we started off by supplying water from day one, cleaning the environment by cleaning the solid waste collection. We provided sanitizers. We ensured that all the women, most of the women in informal settlement were enabled to sew masks so that they could distribute them freely to the informal settlements who cannot afford the masks. This was sponsored by NMS with the national government, and we are now in the process of building 24 hospitals within the informal settlements. So by end of September, there will be new facilities in the informal settlements that will not only help the health standards of this informal settlement, but they will also assist in isolation because they will have inpatient capacity within those hospitals. So we are doing quite a lot. We are expanding Mama Lucy Hospital. We are expanding Badi to include 18 new beds and 10 beds, 18 new beds in Mama Lucy and 10 beds in Badi. We are increasing the isolation facilities within Nairobi, both for the staff of national government, staff of the county government, and Kenyans in general. So we are working round the clock to ensure that we cut down on the spread of COVID that is facing our country. The other problem, as you are aware, business has really gone down because of this disease. So there are a lot of affected families. So this kind gesture we are getting today from Giants Group will go a long way to help the disadvantaged families to sustain their lives. And we would like to thank very much the Giant Group of companies for what they have done to us today. And this, I assure you, will go to at least 4 the informal settlements to be divided into 4 groups so that we can able to reach those families as fast as today or tomorrow. The wheelchairs, I'm very grateful as I'm undertaking the project in Mukuru. It is volunteering to give up space so we can build the road network within Mukuru. Some of those who gave up their houses in order for the roads to be built were 3 disabled families. Their status is quite hurting. They had to give up their houses for the roads to pass. So I've taken upon myself to make sure that immediately I built all the 4 families other houses, because they gave up their houses. But I didn't know how to settle their wheelchair problem. So today I'm very thankful for Giants. These chairs will immediately go to those families so that by today evening they are able to move with these wheelchairs. They've done a lot in order of sacrifice, so this will be a great help to them. So mine is to say thank you very much to the Giants Group. So Altaf, thank you very much. So that's all I have today. Thank you very much.
All right. Do you have any questions?